So we've had a couple of alerts in Australia more recently, including in Sydney, around the Western Sydney area, in Queensland, in South Australia, in Victoria. And it's only been a few alerts, a handful of alerts, but then and a fair few in returned travelers. But it also reminds us that measles is still here and we need to vaccinate against it.
Yeah, for sure. We'll get on to vaccinations in just a moment. We heard those warnings by the World Health Organization there in the introduction. What is the international experience right now with measles? Because we know earlier in January, the UK Health and Security Agency declared a national incident over the rising number of cases.
Yeah, that's right. And what we have seen globally is that there's been a massive resurgence in measles. And this has been going on for a few years. It's not completely new, but it's definitely exacerbated after the pandemic, because what we know is that the pandemic led to a massive decline in vaccination rates all over the world. So in many parts of the world, in Europe, in UK, in parts of Africa, in India, as you said, new outbreak, that we are seeing a massive increase in the number of cases of measles, because measles is a highly infectious disease. It's caused by a contagious virus and it can spread very quickly. One case can lead up to 20 new cases.
So is it just with respect to the international experience in vaccinations, a declining trust in vaccines, or is there more going on?
It's more than just a declining trust. Of course, we know that trust and belief in vaccines and acceptance of vaccines is complex and challenging in many parts of the world. But what we have also seen, and in most parts of the world this is true, is access to vaccines also makes a huge difference. And so what happened during the pandemic, it was a couple of different factors. Many health services weren't able to provide vaccination because either they were directed towards COVID-19 response, or they just had shut down because they just couldn't provide ongoing care, or healthcare workers were redirected. Parents didn't want to go into health services because they were afraid of COVID. We also stopped doing surveillance for many of these diseases because people who were doing surveillance, so monitoring of new cases, were redirected to COVID as well. So all of those have had an impact on the transmission of disease. And of course, due to lockdowns and, border closures, all respiratory viruses like measles, we've seen that with influenza, RSV, we didn't see any cases for 2-3 years in the world. There was actually no cases being detected, but also limited transmission. So now, as we're coming back to life and people are moving around and we are picking up these immunity gaps from lack of vaccination for multiple reasons, as I said, access, also confidence issues, we're now seeing an increase in this highly infectious disease.
So what about, with respect to what you've just outlined there, what is the local experience here? What's the Australian experience when it comes to vaccines? We know that the national immunisation program that the government runs for routine childhood immunisations, which is recommended for all children for MMR, measles, mumps and rubella, I think it is 12 months, at the 12-month mark and the 18-month mark. What trends are you seeing here in Australia?
Yeah, so in Australia, in last year, for our 2 years old, we had almost 93% of children vaccinated for measles, mumps and rubella. Of course, the globally recommended rates are more than 95% for 2 doses of measles, mumps and rubella. So as you said, at 12 months and 18 months is what we give in Australia. So 93% is really good, but of course we wanted more than that. And in Australia, we have a very strong immunisation program. We have high rates, but it still needs vaccination. And as we can see, when we get these cases, the measles vaccine is highly effective. And when we get these cases, it's a reminder that if people are travelling, to go and get vaccinated, check your vaccines before you get overseas to travel. But also, if you're in doubt, go and visit your GP to discuss your immunisation status and make sure that you do have a full course of 2 vaccines.
Yeah, and Meru, very briefly before we go, because we are out of time, if you can just address 2 really brief issues, the likelihood of a large outbreak here in Australia, and can you remind our viewers, some who might not know much about measles, just how dangerous a disease it could be?
Yeah, so we have seen large outbreaks in Australia. Australia has eliminated the disease, which essentially means that we don't see ongoing transmission of the virus. But however, when there is a drop in immunity or gaps or, a population that is exposed due to its highly infectious nature, we can see larger outbreaks. And in 2012, I believe there were, around 2012, there were more than about 200 cases, or about 200 cases in Western Sydney. There was the last large outbreak, and about in 2017 as well, there was an outbreak of measles. So we don't see deaths from measles in Australia. We have a strong program. We can vaccinate, we can provide antibodies, but it is a lot of resources and it can be prevented. We really can prevent the outbreak by ensuring that everyone's vaccinated.